Hello and welcome. I'm Elisa Hernandez, a librarian at Stanford Health Library. Thank you for joining us for our talk, Medicare Open Enrollment. It's my pleasure to introduce our speaker, Maha Justi. Maha is a volunteer HICAP Medicare counselor and is certified by the California Department of Aging. Maha has been assisting Medicare beneficiaries for the past 15 years with all of their Medicare questions. She is a retired Silicon Valley engineer who enjoys helping seniors and their families navigate complex Medicare issues. Throughout the talk, please enter any questions into the Q&A box at the bottom of your screen. And throughout the talk, Maha will answer as many of those as possible. Over to you, Maha.
Thank you so much. So let me share my screen right now. So good evening, everyone. Happy to be invited back here in Stanford. And thank you for joining us this evening to cover Medicare Open Enrollment. As Alyssa said, I have been volunteering with HICAP, but who is HICAP? HICAP stands for Health Insurance Counseling and Advocacy Program. We are federally funded, but saying funded is really kind of an overstatement because the funding is very small. So we are a volunteer-supported organization. We are administered by the Department of Aging. All our counselors are certified by the Department of Aging. I personally have been with the program for 15 years. Our goal is to provide Medicare education. We also have one-on-one counseling for every particular situation. You're welcome to contact us, and we would look at your case. There are HICAP offices in counseling sites all over the county, our county. I belong to San Mateo County, but the information I will give today is also relevant for other counties. But if you want more detailed, specific plan information, you would have to contact your own HICAP county. Our service is free, unbiased. We are not associated with any insurance companies, and absolutely confidential. Okay, so tonight I'm going to go through an agenda. I'm going to start out with talking about something called original Medicare and what are the alternatives. When you talk about Medicare, the terminology is very important. So I'm going to go over that because I can appreciate the fact that you get bombarded with a lot of literature about Medicare. And unless you understand the terminology, people are really lost. And then I'm going to move on to the annual enrollment, what Medicare beneficiary can and cannot do. I'm going to talk about an important issue that is not really addressed a lot, which is premium surcharges and how it relates to your income, how your premium could change with your income. And I'm going to end up with what is new in 2024. I will have stopping points so to take questions. I'll try to get as many questions as we can tonight. Okay, so let's start with the basics. Who is eligible for Medicare? You need to be 65 or above. Some people get confused because Social Security is something you could be eligible for when you're 62, but Medicare is 65 and above. You can have Medicare under 65 if you are disabled by the definition of Social Security. There's also cases where if you have certain diseases, ALS and so on, you could apply for Medicare. So that's the eligibility. As far as the enrollment is concerned, your very first enrollment time is 3 months before the month of your birthday and 3 months after. So it's a 7-month period where you can sign up for Medicare. You can delay the enrollment with no penalties if you are working. People don't want you to have two insurance needlessly. So if you are actively employed, you can delay your Medicare enrollment with no penalty until you stop working. Then you can jump in and sign for Medicare. Okay, so there's something called original Medicare. The term original Medicare is very important. It relates to this card here. We call it the red, white, and blue card. When people sign up for Medicare, you get this card. It has information about something called Part A and something called Part B. And on a personal note, I just got mine last week because I will be Medicare eligible in December. And I was so happy to get it. My husband mentioned that you're the first person I know that's so happy about getting old. And I said, if you have an insurance with $7,000 deductible, you'll also be very happy to have Medicare. So what is the original Medicare, the word original Medicare? This refers to something called Part A and Part B, hospital insurance and medical insurance, nothing else. The program started in '65 by Lyndon Johnson, so it's been around for a while. It's funded by your payroll tax, general revenue, and your premium. Important to know, when you want to enroll in Medicare, the agency that does that is Social Security Administration. So you have to go to Social Security Administration or get online to sign up for Medicare. However, once you are on Medicare, there's another agency, that's the Center for Medicare and Medicaid Services, that actually manages the program. Both of these agencies, these are federal agencies. So what is Part A covers? So I like to think of Part A as institutions. Everything in Medicare has to be medically necessary. So it covers inpatient, hospital, hospice, some inpatient, some religious organization. The other part is called Part B. Again, we're talking only about original Medicare. So this is the doctor's part of it. Outpatient, clinic, durable medical equipment, diabetic testing equipment, and a whole host of things. So Part A and Part B. Now, anytime we talk about any insurance, we talk about three things. The first thing we talk about, the premium. So the premium, and we have the number for 2023 because 2024 has not been released yet. But when we talk about the premium for original Medicare, if you worked in the US for 40 quarters, which is 10 years, either you or a spouse or an ex-spouse, your premium is zero for Part A. However, Part B, which is for doctors, you do have to make a monthly premium. In 2023, that number was $164.90. Our estimate right now, that's going to go up by $10 a month for 2024, but we don't have the final numbers yet. Second thing we talk about when we talk about insurance is deductible. Deductible is something that you have to pay first before you actually get the services paid for. So Part A, which is the hospital, was $1,600 per benefit period. What does benefit period means? It means basically 60 days. So you go to a hospital, they take care of you, and they say, okay, now your deductible, the first $1,600, you have to pay yourself. You go home, everything is beautiful, no problem. You come back on day 61, and they say, oh, your benefit period expired. You have to pay that $1,600 again. Now, that $1,600 is going to go up in 2024 slightly. We don't know the final number is. So it could add up because it could roll multiple times during the year for Part A. Now, for Part B, it's a flat number per year. So in 2023, that number was $226. So once the first appointment you have, the first $226 is something you have to pay before any insurance kicks in. That brings us to the last part of the insurance, which is the copay or co-insurance. Now, for hospitals, it is zero for the first 60 days in the hospital. Very few people would stay 60 days in a hospital. After 60 days, then there's a copay, but the first 60 days are basically at zero copay. As far as the Part B is concerned, it works at an 80-20. So you go to a doctor for a visit, Medicare will pay 80%. You are responsible for 20%. Of what? Of something called an assigned number. Assigned meaning that doctor has a contract with Medicare, and they agreed that an office visit will cost X amount. So if they agree that it's $100, that your provider cannot just come up with a different number. They have to base the 20% on that $100 that they agreed to. Now, when you look at what's in red here, you come in mind, remember the word gaps. So you look at it and you say, gee, I might be somewhat underinsured because there are places where things could really kick in here and I could be financially liable. So there's the word gap. So for most people, when they look at that, they would say original Medicare is really not enough. So then we start talking about supplementing it. How do you supplement Medicare so you can have a nice coverage with a financially secure situation? So the first thing that you're able to get is something called Medigap. So that word gap comes up again. So what is Medigap? Medigap is a Medicare supplement that only supplement A and B. So there are these gaps. So if you have this insurance will pay for some or all of what A and B does not pay, depending on which plan you buy. Now, those plans are sold by private companies. They are very highly regulated, but nevertheless, they're private companies. This is a federal program. This is a private company. Now, with that Medigap, you have something called a guarantee. A guarantee says if you have original Medicare, within 6 months from your effective date of Part B, you are able to buy a Medigap insurance from any Medigap provider, and they cannot subject you to any underwriting, and they cannot refuse you, and they cannot charge you anything different. So this is your guarantee. So it's a short, limited time guarantee. We tell people to make sure that they get their insurance with that time. It doesn't mean that afterward you cannot get it. Well, it becomes completely up to the insurance provider. But this is a federal guarantee. And this insurance comes into different varieties depending how much coverage you want. So there is, unfortunately, it uses also A, B, C, F, G. So it could be confusing, but we talk about Medigap G or Medigap F. So it's something that supplement the original Medicare. Now, is that enough? For most people, that's not enough. So what else can we do to supplement our coverage? Well, prescription drug. So prescription drug, again, it's something that is sold by private companies. You can choose depending on your medication, and there are tools to help you pick what is the correct provider for you. So with this whole stack together, then you can start thinking, yes, now I have really good coverage. I have the basic hospitals and doctor. I have a supplement to cover my financial exposure here. I have prescription drugs. Now, when you have Medigap, unfortunately, it's not free. So there's also a premium. So the premium will depend on what you pick. And we have a presentation November 2nd that goes into much more details on that. But just to give you an overview. So the premium could be anywhere between $100 and $300. And it's active as soon as you paid your deductible. And one thing to note that if you pick a plan, let's say Plan G, so Plan G, they must provide the same benefit that is dictated by the Center for Medicare, and all of them are the same. So G is G is G. So people ask, why should I go with an expensive G? Well, that's completely up to you. They might be throwing in some extra benefits, but you have to decide if these extra benefits are worth it for you. But again, G mandated by law is the same for all, or F is the same benefits. The Part D with the prescription drugs, it could be anywhere under $5. I actually saw in San Mateo County this year for 2024, there's planned for 40 cents. It can go up to 150 or more. The deductible, again, changes. This is a number for 2023. And the copay will depend on the tier of medication. So if you have a generic, it might be $1. If you have a specialty drug, it might be 25%. It could be a 25% of a very high number. It could be a very high number. Okay, so when you ask somebody, what do you have, what coverage you have, somebody should be clearly able to say, I have Medicare A and B, I have Medigap with company X, and I have a prescription drug with company Y. And typically you would have one card for this, one card for this, and one card for this. If you have 3 cards, then you're on this side of Medicare. But there are alternatives. What are the alternatives? The alternative is something called Medicare Advantage. And this is where people get really confused. No, Medicare Advantage, it's called Part C, but it's not part of anything really. It's an all-in-one plan. And what physically happens is you sign up for Medicare A and B, you pay your premium, and then these plans would come to and say, well, we can do a better job. We can offer you all this in one plan. So the government says, more power to you. We'll give you the money that we have saved through the payroll taxes for this client. We'll give you the premium that they have given us. We'll take them, you go there, and they become yours. Joe becomes yours. You take care of them. We don't want anything to do with you. Well, they still have to follow the regulation, but you become on this side. So Medicare Advantage is a marketing name. It's not an advantage. It's not a disadvantage. It's just a name. And to really must understand that these things in that color are sold by private company. So what's an example of Medicare Advantage? Well, Kaiser is a Medicare Advantage. So that's a very clear cut. Now they have companies, for example, United Healthcare, AARP. Now AARP does have a Medicare Advantage plan, but they also have a Medigap plan, and they have a Part D plan. So when you get this literature from United Healthcare or AARP, you need to really know what are they trying to sell you. Are they trying to sell you this, or are they trying to sell you one of these two? How much does it cost? Well, you still have to pay the A and B if you have, some people have to pay for A, but you still have to pay your B premium. And once you pay that, the government takes it and gives it to the provider that is that you choose. That provider can say, okay, on top of this number, we would like you to pay another $89 or $0. There are many plans that are $0 or $120. You know, it really depends. Everybody gets the same. It's not dependent on their age or anything. They just come every year and say, AARP Secure Horizon this year is going to be $100. So everybody pays the same. There's no deductible. The plan is immediately effective. And how much you pay as a copay really depends on the service. So for example, remember when I said you go to the hospital and you could have a deductible for $1,600 and so on and so forth. As far as the Medicare Advantage is concerned, they give you a long list and they would say, if you come to the hospital, each day will cost you $200 for up to 5 days. Or they could say, if you go to a doctor, specialist, it could come to you $35 and so on and so forth. So what are the advantages and disadvantages? What are the differences between these two? So if you're on this side, you cannot have both. You can have either this side or this side. So I call this side a Medicare Plus. So Medicare Plus, the key thing here is you can go to any doctor or any hospital that accept original Medicare anywhere in the US. Obviously, they have to be accepting new patients. Now, Medicare Advantage, for the most part, is a network-based. So it could be an HMO, it could be a PPO, but there's a concept of a network. So you can only go to doctors within that network. However, if there's an emergency, you are allowed to go anywhere. So that's an exception. On this side of Medicare, there's in most cases, you don't need a referral. You can go to a specialist. You can call a dermatologist or an eye doctor and just go there. In the case of Medicare Advantage, you do definitely need a referral from your specialist. As far as cost is concerned, in both cases, you have to pay your Part B premium. In this case here for the deductible, there is no Part B deductible for Medicare Advantage. There's a premium for Medigap, but there could be also a premium for Medicare Advantage. Copay in most cases is very small with Medigap. With Medicare Advantage, copay could be a lot more because it depends on the services. So when people say, well, I think it's cheaper to be on Medicare Advantage, we say, well, we don't know, depending on how sick you're planning to be next year. But there is an out-of-pocket maximum that could be, depending on the plan, it could be $7,000, it could be $4,000, but there's definitely exposure here. Your Part D premium, you have to pay it here because you're buying a Part D, and here it's included as part of your Medicare Advantage. Copay, both of them have copay. So in summary, if you have Medicare without a supplement, you could be really exposed because when you go to a doctor and you have to have this 20% that you are responsible for, there is no limit. So if you go to the doctor every day, that 20% could really add up. But of course, if you have a Medigap plan, then you don't have that problem. Here, there is also an annual limit. It could be $4,000, it could be $7,000. Okay, so with that part of the presentation, you should be very clear in your mind which side you're in. Are you on this side or are you on this side? You cannot be on both. And that's a very, very critical part to being able to know what you need to do for open enrollment. Okay, so this is a stopping point if somebody has questions about the very basic Medicare.
Meha, I see one question currently in the chat.
Yes.
It is Medicare available for self-employed individuals?
Yes, when you are employed, whether you're self-employed or you're working for a company, you have to pay payroll tax. As long as you're paying payroll tax or you are married to somebody who has paid into the FICA payroll tax, when you're 65, you're absolutely eligible for Medicare. Okay?
Thank you. No more
Okay.
questions in the chat.
That's it? I continue?
That's it.
Okay, let's go on. So let's talk about the bulk of this presentation, which is annual enrollment period. Now, again, I should say that there's a lot more detail that I will cover on November 2nd about the Medicare, the ins and outs of Medicare. So I would strongly recommend that you sign up for that webinar as well. But now let's talk about the annual enrollment period. So it could be very overwhelming, the various times where you can do things within Medicare. For example, when you first become eligible, there's something called initial enrollment period. Well, when you stop working, regardless what time of the year, and you want to get into Medicare, there's something called special enrollment period. And each one of those periods have its own rule. What I'm going to talk about today is the annual enrollment period. This is meant for people who are already enrolled in Medicare. It is the time to reevaluate your coverage and make changes as appropriate. This is a time that starts October 15 and ends December 7. During that time, you could evaluate, change, certain things, and whatever you do becomes eligible, becomes effective January 1st, then you're locked in for the next year until you sign up for something else. So it's a pretty important time of the year that's coming up. Why we want to do anything? Well, you need to confirm your coverage meets your health needs. Now, you might say, I love my coverage, but the plan might not love you back exactly the same amount. They might be changing things that you're not aware of. So you need to confirm that everything is still consistent. You also need to confirm that it meets your financial needs. You don't want to really be surprised by having a prescription plan that your copay for a medication used to be $5 and you didn't bother to check, and you come January to the pharmacy and they say, oh, gee, your copay now is $100. It does happen. So we highly, strongly recommend people to double check. It's also an opportunity to correct an enrollment mistake. Let's say you're enrolled and you say, I really hate that plan, right? So it's your opportunity to change. Again, you don't want to have any surprises when you're locked in the beginning of the year. Okay, so what can you change? So what you can change is, let's say you have a Medicare Advantage plan with ARP, with Brand New Day. There's multiple plans. This is a time to check if the plans, you still like the plan, and you are able to change to another plan. You are also able to say, gee, I made a mistake. I hate managed care. I really want to go back to original Medicare. So this is also an opportunity to go back to the original Medicare with restriction, very important restriction. The third thing you could change is your Part D. Well, your medication changed, or you checked and you realize your copay is no longer what you were paying, and another plan could offer you a much better copay. Then this is your chance to change your Part D. What you cannot do is get a Medigap. Remember in the beginning of that, in the last part, I said Medigap is something that you have a guarantee to be able to get within 6 months from signing up. Now, very important that if you decide, I'm not going to stay on this side, I'm going to go to Medicare Advantage, and you've been on Medicare Advantage for 10 years, then you suddenly decide, I hate it, I need to go back here, you have no right to get a Medigap. So this could be a really major event here because you'll be financially exposed. So we told people, when you're looking at these alternatives in the beginning, when you're 65, please be informed of the rules. There's something called a trial period. You can come here and try it, and if you don't like it within 12 months, you can go back and be enrolled again. But this is very restrictive as far as being able to get into it again. Okay, so with this picture in mind, let's say you have a Medicare Advantage and you want to check things. How do you check things? Well, first of all, they send you, by law, they have to send you either on your online account or paper an update. They'd say, here's your new premium, here's your here's what we're going to cover. They could also say, oh, we're not going to renew, we're not going to offer this plan anymore, sorry. So if they say that, if your plan leaves the Medicare Advantage, they will definitely tell you about it. And this is one of the cases, one of the rare cases where you have the right to get that guarantee Medigap again. So it's really important to look at what's happening here when you get that material from your current provider. How do you check things? Well, there's a very nice website, Medicare.gov, and be careful, there's Medicare.org and COM. This is not. This is Medicare.gov. And there you will check your medication. Are they still in the list of the formulary for next year? Is my copay still reasonable? This is how you check in this website. The third step is you go to your insurance website and double check or call your doctor and say, are you still on my plan? My plan is Brand New Day. Are you still on that plan? Because they write contracts every year. So you don't want to come the next year and find out your doctor is no longer on that plan. So this is important to check. The plans also decide which hospital you can and cannot go to. So you need to be comfortable with that decision. Last but not least, if you're unhappy with the plan, when you check your current plan and you decide, no, it's really not working for me, then you use the same website to research the alternatives. If it's complicated for you, that's what we do at HICAP. You set up a counseling meeting, we get your information and help you through that search process. So what else can you do through open enrollment? Well, as I mentioned, you could change your Part D. This is your medication part. Again, they send you a big book with the formulary. Honestly, a lot of people just don't look at it. But at least if you don't look at here, please either ask HICAP or go yourself on Medicare.gov and make sure all your medication are still covered. And what could typically happen in these cases, you could have a medication that's a brand name and they pay for the copay, but then a generic came up. So they would like you to take a generic and they really raise the copay on the brand name. So you want to know that ahead of time. Again, if you're unhappy with the current plan, you go to the same website and you enroll in another plan, or ask HICAP for assistance in that search process to make sure you can understand what are you looking at. So what does that Medicare.gov look like? You physically type Medicare.gov and you get this picture, depending on your screen size and all. So you click on Find a Plan. Or if you set up a Medicare account, you can go into your account. Once you click here as a guest or you log in, then you get another screen that says, what do you want to do? Well, you say, I would like to explore 2024 plan, but I can also go back and do it for 2023. So I can, make sure I'm looking at the right thing. Is this, my plan was offering this, now it's offering that. It's very important, the zip code, because all those plans are zip code dependent. Understanding your result of the medication plans, whether you're in a Medicare Advantage, which has that as part of the Medicare Advantage plan, or if you are a standalone, they all have to follow some rules. And what are those rules and what they can and cannot do? So one of the important things to understand is that those plans, let's say it's Silver Script or WellCare, they have pharmacy-dependent pricing. And they break their pharmacy into 3 categories. They have something called preferred, there's something called in-network, and there's something called out-of-network. So we get this a lot when people ask us to do a search for them, and they say, I go to CVS. And we say, great. And we run it with CVS. But typically in HICAP, we run it with at least 5 different pharmacies. And we would come back and say, oh, here's the price with CVS, which is in network. However, if you cross the street and go to perhaps Walgreens or Costco, you'll save $1,000. So in network does not mean you get the same price as preferred. And this is a very, very important point that people don't realize, that might be way overpaying if they're not going to the contracted pharmacy that is preferred. Not in network sounds like a nice name, but really it's not the best price. Preferred is the best price. They have their own formularies, so they don't have to cover every medication. So if your doctor says medication X, that company does not have to cover it. but they do have to cover equivalent or something similar. They have to have like, I think the rule, they have to have 2 medication for every disease type, but there are some protected classes like some cancer medication, for example, they have to cover all the medications. So this is the formulary. And when you run Medicare.gov, it will tell you if your medication is on a formulary or not. The plan has their own restriction. They can have quantity limit, they can have pre-authorization, they can have a step therapy. They can say, well, you have to try this medication first before we let you have the other one. So, and within the plan, they don't really agree among themselves what is a tier 1 medication and what is a tier 2 medication. So it's completely up to the plan to decide for their own which medication they're going to put in one tier. And the implication, of course, the copay is higher as the tier goes up. And again, as I mentioned, it's zip code specific. We get people that says, my cousin who is in Napa Valley really like WellCare. Well, first of all, that plan might not be offered here. And even if it's offered here, her medication is not your medication, so the answer would be completely different. Okay, so the last part that can be changed is this switch between not just switching within what you have, but really leaving what you have and going to the other side. So it could be because you hate what you have, or you have too much financial exposure. There are many reasons why you want to switch. It is not common to switch, but there are cases. For example, if you have a plan here and the plan leaves, the plan says, sorry, we're not going to offer the plan in 2024, then, well, you could stay with a different plan. But if that plan doesn't offer you the doctors that you want, then you might have to switch. And that's one of the rare cases when, if your plan leaves and you go back here, you have the right to get a Medigap with no underwriting. How do you switch? If you are on the original Medicare side and you decide to go to MA, again, you go to Medicare.gov, you enter your medication, because remember, the MA plan has all-in-one, so you need to check your medication. You can, if you have a Medigap, you cancel it because you don't want both, and you have to continue to pay for your Part B premium. Now, if you're going in the other direction, you have an MA plan and you want to go to the original Medicare side, you have to contact your Medicare Advantage provider and disenroll from the plan. Then once you disenroll, you automatically have original Medicare. You don't need to enroll in original Medicare. You automatically are enrolled in original Medicare. When you go to the Medicare.gov, you need a prescription drug plan. And then you need to find out, do you have a guarantee right? And as I said, you have a guarantee right if your plan leaves. Otherwise, you don't have a guarantee right, so you might not be able to get a Medigap. So tread carefully in this situation. Okay, questions?
Okay, there are a few questions in the chat. There is one about foreign coverage. That's all that it asks. Could you comment on foreign coverage?
Yes, so original Medicare does not cover you outside of the US, period. Now, if you have a Medigap, depending on the Medigap plan you have, that Medigap plan may cover some international coverage. They might say, well, we can cover up to $20,000. So that's on the Medigap side. That's completely up to the plan. It's not federally mandated. So if you're buying a Medigap, this is one way they can compete. Now on the Medicare Advantage side, it is not normal to see a Medicare Advantage plan that has an international coverage. It is an HMO typically, so it's really for people that tend to be regional. So the short answer is international coverage is really limited with Medicare. Original Medicare, 0, but Medigap, maybe some.
Thank you. Here's another question. If I have Medicare Advantage now and want to change to Medicare GAAP, can the insurance company refuse me?
Yes, absolutely. So if you have Medicare Advantage and you are outside of the 6-month period from your Part B, and you have been on this Medicare Advantage for a long time, more than 12 months, you don't have a guarantee right to go and buy a Medigap. So it doesn't mean they refuse you. You can ask, but they don't have to. They're not required by law to take you. They could take you, but they're not required by law to take you. However, if your plan leaves, if you are a Medicare Advantage that canceled, that's not going to renew, then you get that guarantee back. Now, there are other cases where you can get that guarantee back. For example, if you are living in California and you sign up for Kaiser, which is a Medicare Advantage, and then you move to a state where Kaiser doesn't exist, then you have no choice. Then you get that guarantee back.
Thank you. Here's another question. If I sign up for a Medigap policy at 65, and then a few years later, I want to sign up for a different Medigap policy, will I have to go through underwriting at that time, or am I stuck with the same Medigap plan forever?
Okay, so I cover this in the next presentation, but I give you a short answer. We are very lucky to be living in California. We have something called the birthday rule. So if you have a Medigap and your birthday is June, and you have a plan letter G or F or whichever you chose, every year on your birthday and 60 days after, you have the right to switch companies. You could switch companies between, so if you have Anthem, you can go to Blue Shield or you can go to United Healthcare, but you can only do it on your birthday and 60 days after. It's called the birthday rule. And the other rule is you can only go down in benefits. You cannot go up. So the way that Medigap plans are structured, they have A, B, C, and so on. So A is the least amount of coverage. It still gives you coverage, but it's the least amount of coverage. And G or F are the highest, or kind of the deluxe. So you cannot start with F and go up, but you can start with, you cannot start with A and go up, but you can start with F and go down.
Thank you. Another question. I'm 73 and still working. I have good health coverage. Do I need to add Medicare coverage?
Absolutely not. So this is when I mentioned in the very beginning, normally when you're 65, you are supposed to sign up for Medicare. However, if you're actively working and actively covered under an employee group health insurance plan, then you could delay Medicare enrollment until you stop working. Now, when you stop working, you have another decision to make. You can decide, now I'm ready to go to Medicare. And at that time, you will have something called a special enrollment period. And basically what happened is Medicare, you go to Social Security and you're 73 and they say, and you say, I'd like to sign up for Medicare. And they say, where have you been? Since 65. And you say, well, I've been working and I had a plan, employee plan. They say, okay, take this piece of paper, go to your employer, have them certify that you have been covered, and then we'll take you. Absolutely no problem. The other choice you make is if your employer has a retirement plan, this is also a time to decide, okay, do I want to go with the employer plan? Does some federal plans don't require you to have Medicare at all. Some other plan says you get A and B, but don't get a gap. We could be your supplement. So there's different variation there. But the short answer is, if you are employed, you have absolutely no requirement to go with Medicare, unless, of course, you hate your insurance with your company, then that's another story. Then you can sign up for Medicare.
Thank you. Another question. Is there something called a Part D penalty for taking Part D in your later years?
Absolutely. And again, this is something that would be covered in the Medicare basics. So the idea really is when you become 65, you have to sign up for all these things, unless you're working. If you're working, you are sheltered. You have no penalty. But if you just decide, I don't want Part D for whatever reason, because I'm healthy, I don't take medication. Now I'm 80 years old and I want Part D. And then again, they say, where have you been? And by the way, for every month you delay Part D from your original date, you have a surcharge of for every month is a 1% surcharge that really adds up over the years, and that stay with you for the rest of your time. So there is definitely a penalty if you don't sign up unless you have already coverage. What we call is creditable coverage, which most employer plans are creditable. Creditable mean they're as good as or better than Medicare. But if you have nothing, then you will definitely have a penalty.
Okay, last one. In switching from Medicare Advantage to original Medicare, are there any considerations if you have a pre-existing condition?
Original Medicare knows nothing about pre-existing conditions. So there is absolutely nothing. Again, the question becomes a Medigap. So if you have a guarantee right to buy a Medigap, which is a supplement, then they're not allowed to ask you anything about pre-existing condition. If you don't have that guarantee, then they absolutely will ask you. They could ask you. But I've seen companies like Blue Shield would come sometime during the year and they would say, underwriting holiday, come to us and we will not subject you to underwriting. But that's completely up to them. So underwriting or pre-existing condition only becomes an issue if you don't have a Medigap guarantee. Now, the A and B themselves have no concept of pre-existing condition.
Great, thank you.
Okay. Should we go on?
Yes.
Okay. So I will shortly go over something that has to do with your income that a lot of people are not aware of. So there's something called IRMA, income-related monthly adjustment. It's kind of a mouthful. And basically, what it really says, there are two parts of Medicare's, that Part B and Part D. Nothing to do with Medicare Advantage, just Part D and the portion of Medicare Advantage that's D, the drugs. We don't want you to, everybody has a premium, and the premium is, okay, so you could say Part B premium this year is going to be $174, for example. And we always say for most people. What does that mean for most people? It means that if your income, if you're a single person and your income, and it changes, that breakpoint changes every year. If your income is above a certain limit, we're going to ask you to pay a bit more for a Part B and Part D. Now, how to decide? The people that decide that are the Social Security Administration. You get a letter, it says, oh, by the way, your premium for 2024 is going to be the standard where everybody pays plus this extra income adjusted. So what they do is they look at your income from 2 years before. They actually have a link to the IRS. They look at your modified adjusted gross income from 2 years ago and look at that income and say, are you subject to this surcharge or not? Now, it could very well be that 2 years ago you were working and making a lot of money, but you stopped working and now you're not working anymore and your income is not what it was 2 years ago. So they made an assessment based on 2 years ago, but you have what's called a life event. They're a limited life event. A life event could be you stopped working, you reduced the number of hours, you got a divorce, somebody died, your income went down. So when they send you that letter that says we're going to charge you this extra surcharge because of your income, you can appeal it and go there with a little form that we can give you the information. You go to Social Security and say, hey, My income is nothing like what it was 2 years ago. Please don't charge me based on what it was 2 years ago. And they will make an adjustment. Now, very important to know that it's not retroactive, and they're not going to come and tell you anything. You have to ask for it yourself. And I've seen many people paying quite a bit because they're not aware of that. So, and the difference could be really dramatic in what you pay. So this is for 2023. So if you're a single filer and your modified adjusted gross income was 97,000, I think this year is going to be 100,000, or joint, then you, if it's under this, you basically pay the standard premium, whatever the standard premium is for the year. Now, if your income went up by $1, you're going to have a surcharge of $65.90, and that number changes every year. So instead of paying this, you're going to pay this, and it just keeps going up. So it is something to, when you're talking to your financial people, you know, you just, if you're far away from these breakpoints, yeah, that's okay, but it's kind of silly to $1 that could put you up in this really huge difference that you might consider not taking that extra $10 from your IRA or and so on. So just something to be aware of. Same thing with your Part D, which is prescription. Again, there's if you have this income and there's no adjustment. So if you go with let's say WellCare, and WellCare says the premium is $10 per month, that's all you pay. There's no adjustment. So you only pay the $10. There's nothing extra. But if your income goes up, then your premium for that would go up. So you could be paying $10 for your insurance, but then you can have a surcharge of $50 because of your income. So again, this is something to understand and be aware of, and appeal when appropriate. Any question on that part?
All right, looks like there's a question. Would selling my house qualify as a life event? I had a big income, but now have to live off that.
Unfortunately not. So, and some people tried. You're welcome to try, but selling your house is not a life event. It's not considered by Social Security as a life event.
Thank you. And another question. If someone is 65 and actively working for a small startup with less than 20 employees, can I stay with my employer's insurance, or should I enroll in Medicare Parts A and B?
And is the person under 65 or?
They are 65.
They are 65. So, okay. So typically, there's a rule that says if a company is 20 employees or more, the employer cannot ask them to have Medicare. They have to be able to offer them the plan as they would get as a younger person. But if the company is small, then the company could ask them to sign up for Medicare because they're small and the cost involved and so on.
Thank you. And one more. I'm 67 and still working. I have Stanford Medical Plan, and I also cover for my husband, who is also 67 and not working. When I stop working in 2 years, I will enroll in Medicare. Can my husband do the same thing with me for no penalty?
Okay, so the current coverage is a Stanford health plan for both the husband and wife, correct?
Yes.
Yes. So the answer is when you stop working and you both go to Medicare, there is no penalty because both of you are sheltered under the spousal plan. She would be, or he will be sheltered under the spousal plan. So it doesn't really, as long as it's part of an active plan, it doesn't matter which person is actively working, both will be covered, sheltered from penalty.
Great, thank you. That's all.
Okay. So let's go to the other part, which is what's new, 2024. So the Inflation Reduction Act started in 2023, and some of you recall one of the major provision was that insulin copay was capped to $35 per month. What a lot of people didn't realize at the time is $35, so because they're all different kind of insulin. So you have to make sure that the provider that you select cover this kind of insulin. If they don't cover that kind of insulin, then they don't have to give you a cab of anything because they don't cover it, period. So this is just something to be aware of, and this is still the case for 2024. All vaccines are zero. It used to be very expensive to have Shingrix, for example, as part of the 2023, which is still valid, provision, that vaccines are zero copay. And there was a provision that when you enroll, there were some dates when you enroll in Medicare, there might be, if you miss deadline, there could be some delay in getting coverage, but now Medicare is always effective the next month when you apply. So if you are applying in June 20th, your Medicare is effective July 1st. There's no waiting. Now, an important provision in 2024 is in Part D coverage. For those of you who are familiar with how Part D is structured, and again, it's something we'll cover in November 2nd, there's something called catastrophic coverage. So basically, when you have a Part D plan, whether it's part of Medicare Advantage or part of the original Medicare, it has phases. So first, there's a deductible phase, and then there's an initial coverage phase. There is something called donut hole, and there is something called catastrophic. Now, catastrophic says, when you get to that phase, which is basically either you and your provider, your company have paid the equivalent of $8,000. It doesn't mean that you personally paid $8,000. You and your provider, the retail cost of your medication was $8,000. You are now in the catastrophic phase. When you get to catastrophic phase, all your cap to pay is 5%. Now, 5% of a big, expensive medication could be very expensive. Now, that catastrophic 5% is now zero. So when you get to the 5%, once you get to catastrophic coverage, you are done. You don't have to pay anymore, which is really huge for people that have expensive medications. To look forward in 2025, there will be a cap, out-of-pocket cap on all your expenses to $2,000, regardless what the medication cost, if it's covered under your insurance. 2,000 would be the limit. We don't know how exactly it's going to be implemented, but that's the plan under the Inflation Reduction Act. Okay, something to cover, again, because this is open enrollment and there are cases where some Medicare Advantage plans are leaving the market for whatever reason, they're leaving the market. So if my Medicare Advantage leaves the market, what do I do in 2024? You have the right. You have the right to pick another plan, but you have the unique right to be able to go back to original Medicare and a guarantee to get a Medigap. So be aware of that and use it to your advantage if this is what you want to do. Okay, so in summary, let me just cover our services. We do one-on-one in HICAP, one-on-one, phone or in-person counseling. We review your plan options, whether it's Part D, Medicare Advantage, or Medigap. We review it with you. We can do all the legwork and give you a summary and discuss it with you. We can highlight financial assistance programs that you might not be aware of. Most people, when they think of financial assistance, they think of low income, but that's not absolutely true. There are many middle income assistance that is available. Some of it coming from pharmaceutical companies. Some of it is coming from the plan themselves. And honestly, people don't take advantage of it. So we can point that out if you happen to be in one of those situations. We can assist you in your enrollment. If you don't know how to enroll, you don't want to be on the phone, or you don't feel comfortable calling on your own, we can be on the phone with you, or we can help you enroll online. We can contact Medicare to follow up on any issue on your behalf. We have as a Medicare counselor, we have something called Unique ID, where we have a special Medicare hotline staffed by very knowledgeable Medicare people that actually answer the phone immediately. And we can ask them things on your behalf. You don't need to be on the phone with us, so we can resolve the issue for you fairly quickly. We can assist with Medicare or insurance appeals. We can provide county-specific aggregate plans. What I mean by that is now is the time where the Medicare Advantage plan are coming with all their plans. So our office is crazy working to aggregate all this information in a big spreadsheet. So you don't have to go to every website and spend hours looking at Medicare.gov and trying to figure out what is being offered and what's the difference. So we try to aggregate all that information so it's easy for you to see. We should be hopefully done by that at the latest by the end of October. And the reason for the delay, because the plans are not giving us the information timely. If you remember, open enrollment is until December 7th, so you still have plenty of time if you have that information by the end of October. As I mentioned in the beginning, I am from the San Mateo County, and the plans are different in Santa Clara County. And if you call our sister organization there, they do the same thing. So they can also help you exactly in the same way. So our goal is to educate, inform, and advocate on your behalf, but we cannot pick a plan for you. You have to make that decision yourself. Okay, takeaway from this presentation. Understand where you are in the Medicare ecosystem. Are you in the Medicare Plus Medigap, or are you in the Medicare Advantage? And be aware that private Medicare plans are designed for shopping around. You would get a lot of deals when you're 65, and they hope that when you just put it in autopilot and you never change. But meanwhile, there are much better deals and much better coverage if you shop around. So unfortunately, this is kind of the state of the thing. You need to be shopping around. If you're not reviewing your plan every year, you're likely paying too much. Please review your plan even if you absolutely love it. Do not hesitate to ask help from HICAP. We're here to help. And here's our information, and I can take any additional question if you have.
Thank you, Maha. It looks like it's 6 after, and we have 8 questions in the chat. How would you like to handle that?
Yeah, go ahead. I'm happy to answer.
Okay, great. My former employer, Stanford, offers both types, and I am on Advantage. I want to convert during their open enrollment. Am I still stuck with the MA?
Okay, so are we talking about an employee plan, or are we talking about a retirement plan, or are we talking about Medicare?
Yeah, would the asker like to clarify in the chat?
So what I covered today really is people on Medicare, not in an employer plan or a retirement plan. Now, if you're on a retirement plan, you have retirement plan rules. And within the retirement plan, they have Medicare Advantage. They basically also have their own enrollment period, and they say, okay, these are your choices. Now, you could choose to leave your retirement plan altogether, but if you leave your retirement plan altogether and go to the original Medicare, you have no guarantee for a Medigap. And if you need more clarification, we'll be happy to take that on offline or one-on-one counseling.
Thank you. Here's another. I heard that traditional Medicare does not cover annual preventative checkups, such as blood tests. Is this true?
This is not true. There is a list of there's a long list of preventive conditions and annual wellness exams that original Medicare cover. For example, there's depending on your case, if you're a woman, there's a mammogram that are preventive. There's a very long list of preventive things that are covered. So, but again, so there's a wellness exam, and if the wellness exam says my doctor asks for a blood test, then Medicare does cover blood tests as part of the normal coverage. It's not part of the preventive test, but it's covered under Medicare.
Thank you. Can you speak to the Medicare star ratings, what they do and don't cover when choosing between Medicare Advantage or prescription plans?
Well, I honestly take the star rating with a grain of salt. So basically they sent, there are these things that are, it's a combination of things. It's a combination of customer service. It's a combination of how the plan covers chronic conditions. So sometimes you can get a plan that would send you something. Please come for blood pressure measurement, because they have to be able to show Medicare that they're following up on chronic conditions. So I take that, I mean, I don't go with the lowest rating, but I would take that with a grain of salt. What's important is to understand your rights with Medicare.
Thank you. There's a question on how you can get catastrophic coverage.
I'm not sure what you mean by catastrophic coverage. There's catastrophic coverage. I mean, if you have Medicare, you have full coverage. Catastrophic coverage is if you have, for example, a Part D plan, which is a prescription drug plan. You have to go through all the phases and pay a certain amount before you enter the catastrophic phase. When people talk about catastrophic coverage, they talk about a high deductible plan that only cover them for after they reach a certain deductible. That concept does not exist with original Medicare. It does exist with the Medigap. So you have high deductible Medigap plan, for example. So again, unless I know exactly what the person questioning where they're coming from, I cannot really give you a definite answer. So again, it's something that I would suggest to contact us for a one-on-one counseling.
Thank you. And if your income goes down in the current year or the past year, can you appeal cost, or does it have to be on the 2 years prior?
Okay, so what happens is the only cost that you can appeal is when Social Security sends you a letter once a year and says, dear Mr. Smith, your payment, the surcharge for 2024 will be X. So they based it on 2 years ago. So it doesn't matter, that's what they base it on. Now, what's important is to say, this year, 2024, my income is nowhere near the number you based it on or the year before. So so whatever number you used is wrong. My income in 2024 is really what matters, is what I want you to consider when you're looking at this surcharge, and because of that life event. So although they looked at 2 years before, and if your income was within the limit, they're not going to send you anything. They're not going to send you any surcharge. They're going to send it to you in the next year when they see as you advance, oh, now you're 2 years before. So what's really important is the only thing you need to think about is when you get a letter that says you have a surcharge, the only thing you need to care about is what are you making or expect to be making in 2024. And is that within that break points? And it's within that break point, you just run to the Social Security and says, I don't care what you used, just don't use it because my income is lower now. My expected income in 2024 is within the break points for standard premium.
Thank you. And we have a few questions on what HICAP helps with. Does HICAP help with Medicare Advantage prior authorizations and appeals of denials? And does it help with long-term insurance?
Okay, so there's two parts to it. We always suggest every provider has their own appeal process. if you're stuck with an appeal process, we can certainly help. That's the first part of it. But we don't use that as a first action. You need to do something yourself first, approach the company yourself, because each company has their own internal process for pre-authorization. So we normally don't do that. And actually, what I found extremely helpful is your provider. Let's say if you're going, for example, at Stanford, and Stanford doctor wrote a prescription, and that prescription need prior authorization. I've seen cases where their own pharmacy, although it's not the pharmacy you're going to use, they help with that pre-authorization process. So I would use the network you have already before you come to HICAP, because of our resource limit for that. Now, the second part of it is long-term insurance. We do have some of our counselors that are trained in long-term insurance. So if there's an issue there, then we would refer you to one of those counsel that are certified in that particular area.
Great. Thank you, everyone, for the great questions. And thank you, Maha. Those are all the questions that we have for tonight. And thank you, Maha, for sharing this great information. Thank you to our audience for joining us. And if you'd like additional information or resources, please contact Stanford Health Library, as well as HICAP. His information is currently on the screen. And we hope you'll join us for the next lecture.
And I just should say, there were some questions that came through when the pre-registration. So if we didn't get to them, please contact us directly, and we'll be happy to discuss those with you. Thank you, everyone.
Thank you. Good night.